Let's talk about testosterone. Testosterone is a male hormone that comes from the testicles. I want to briefly describe what's going on when men have low testosterone so that you can understand how this works. It all starts in the brain. There's a pea-sized gland in the brain called the pituitary gland that sends a message to your testicles to make testosterone. When someone has low testosterone, the problem can be in the brain or it can be in the testicles. It's my job to figure out where the issue is. The most common reason for low testosterone in men is related to aging, and the testicles just stop making an appropriate amount of testosterone. Now let's talk about what testosterone does in the body. Most people know that testosterone is involved in building muscle and helping with energy, but it also helps with concentration and memory. When people have low testosterone, they feel tired, they have low motivation, their mind is sluggish, and they might think that they're depressed. Sometimes men have issues in the bedroom like erectile dysfunction or low sex drive. So we know that your testosterone is low, so where do we go from here? So the next step is to do a secondary workup to see if we can figure out the cause. Now most of the time there's no specific cause and it's just related to aging or that the testicles simply aren't making enough testosterone hormone. Regardless of the cause, the treatment is to replace your testosterone. When it comes to replacing someone's testosterone, the idea is just to get you back to a normal level for your age. We're not trying to turn you into the Incredible Hulk. We just want you to feel normal and have more energy. There are two ways to handle the testosterone replacement. One is to use a testosterone gel that you rub into the skin of your arms in the morning. This is the newer way to do it, and the advantage is that we're able to keep your levels very constant and even keel. The medicine just absorbs straight through your skin. The other way to replace testosterone is a once-a-week injection that you would do at home. Both ways are totally acceptable, but there are advantages and disadvantages to each method.
I wanted to do a quick update to this video. Nowadays, the way that we do the injectable testosterone is a little bit different. We can certainly still do the once a week injection, but the downside of that is it's an intramuscular injection. It's a long needle, and people usually get kind of sick of doing that over and over again. The newer way to do it now is to use a smaller gauge needle, and you do the injection in your belly just under the skin. We call that a sub-Q injection, and you do it 3 times a week. And we really only started doing that relatively recently, but almost everybody will prefer doing it that way versus the once a week with the larger injection. And I've just noticed that when we go back and we look at the labs as people are doing these sub-Q injections, the labs seem to be almost just perfect, right where we want them to be. So I've kind of just switched over to recommending doing these 3 times a week sub-Q injections.
I usually recommend people try the gel first. The big advantages are that it's easy to use and it keeps your hormone levels very stable. One disadvantage is in about 20% of men, we can't get the levels high enough in the bloodstream. Another issue is that you have to be careful not to let people come in contact with your skin for the first hour or so. But let me clarify that. When you use the gel, you're rubbing it on your shoulders and upper arms, so typically it's being covered by your shirt, so it's not like it's a big deal, really. The cheapest way to do this is to get this made at a compounding pharmacy. Now, I get a lot of questions about this, so I'm going to explain why I do it this way. Because this is a relatively new technology, the medicine through the skin deal, there's no generic version of testosterone at the regular pharmacies. You might have seen commercials for things like Andro Gel on TV. Well, those are branded versions of testosterone gel, and they're expensive. Usually, even after your insurance pays, you're left with $75 a month for these things. For some people, if you have a high pharmacy deductible, your first prescription might cost like $400, and then you pay $75 a month. So rather than getting caught up in all that, the cheapest way, and really just the best way to do this, is to go through a compounding pharmacy. The place I use in town is called Amity Road Pharmacy, and they charge a flat rate of about $50. Amity Road Pharmacy is located right behind Target between Buffalo Wild Wings and Chili's. Okay, so the gel that they make comes in a small tube like the one that's pictured here. You twist the bottom of the tube and a pre-measured amount of the gel comes out of the top. And then you use your fingertips to rub the gel on your arms and upper shoulders each morning. The key here is your skin needs to be totally dry when you apply this. So if your normal routine is to get up in the morning and take a shower, just make sure that you dry your skin off completely and wait a few minutes before you put this stuff on. One other tip, when you apply the gel, you don't have to rub this stuff in. You just need to sort of gently spread it out across your skin. Again, upper shoulders, upper arm with your fingertips for maybe about 30 seconds on each side. Okay, so in terms of monitoring all this, typically what I like to do is check your testosterone levels again in about a month with a repeat blood draw, and then we can adjust the medicine up or down based on your levels. Once we've got the dose right, I usually will follow your levels maybe every 6 months or so. Now, one question that people ask is how soon will I notice a difference in the way that I feel being on the testosterone? And I think the rule of thumb is probably about after 10 days, you should be noticing an improvement in terms of your energy, your concentration, and just how you feel in general. The key is to be very consistent with this and don't miss doses. Okay, we're on the home stretch. The last thing I want to mention here is that anytime we start a medicine, there's always a list of theoretical risk factors that you should be aware of. So with this, there's a small risk of increasing your prostate gland size. So just let me know if you're having any problems with your urine stream becoming weaker. I don't think that you will. Most people do just fine. Also, there is a small, again, theoretical risk that if you're on testosterone at high levels, it could increase your risk of having prostate cancer. Now, this is certainly not something I've ever seen, and the prostate specialists, called the urologists, put people on testosterone all the time. And again, in my mind, if all we're trying to do is get you back to a normal level, then I think the risk of this is very low and not something you need to worry about. The other thing that should provide some reassurance is that we check your PSA, which is called prostate specific antigen, each year, which is how we screen and assess for prostate cancer. One other thing to consider, if you're still thinking about having kids down the road, just let me know because we need to have a conversation about other treatment options. Again, I have a lot of men on testosterone replacement, and almost everyone will say to me that they feel significantly better and it's worth the hassle of putting on the gel each day or even doing the shots if it comes to that. Well, that's it. I hope you feel more comfortable with what's going on and how we're going to handle it. I'll be right back in the room to answer any further questions that you might have about all this.